Good morning. We're back to our weekly healthy facts, and today we have two physicians with us. My name is Zahir Sahlul. I'm a critical care specialist and pulmonary specialist at Christ Advocate Medical Center in Chicago, and we have with us Dr. Muhammad Tabriz, who's an infectious disease doctor at also Christ Advocate Medical Center in Chicago, and Dr. Abdul Hafiz Sharaf, who is an internist from Detroit, Michigan. Welcome. We're going to try to be short, like we have done last week, and I appreciate all the feedback and the input and the questions that came since last time we met a week ago. And please try to share this with your friends and network to expand the benefit. And if you have any questions about COVID, the COVID vaccine, or health-related issues, please, you can send them to me or direct message me, and we'll try to respond to them in the weekly Facebook Live. Dr. Tabriz, one of the questions that always comes to mind is nowadays is these new strains that are coming out, and every day we're hearing about a new strain. So we have the UK strain, we have the Brazilian strain, we have the South African strain. Should we be concerned about these new strains? And what's the difference between a strain and mutation? Because people are getting confused now. You are muted.
Thank you, Dr. Salul, and good morning to everybody. So about the mutation and the strain, mutation means, the virus, this is a RNA virus. So the RNA has, the genetic structures that when they multiply, during the multiplication, there's different nucleotide can change this structure. The virus itself correct them. That's normal. So mutation is a normal phenomena in virus. But usually, for example, COVID virus, SARS coronavirus 2, the natural mutation happens about 1 to 2 nucleotides, those tiny structures that define the RNA. It's normal to have 1 to 2 mutations per month. So there's so many mutations that happen. However, when there is more than few of expected mutation, then you get a new strain. And so far, there has been so many other strains identified in different parts, but 3 are in the news and 3 are more important, as you mentioned. One is the UK variant, the other one is the South African variant, and the other one is the Brazilian variant. So this mutation that happened in this new strain or different strain that we have been seeing is important because rather than having only a couple of mutations, this strains has more than several mutations and changing some its structure, that how it infects, how it interacts with the body. In UK strain, B1117, the changes happen in the spike protein. As we know, the spike protein is the main structure that virus use to enter our body and attach. So having change in the spike protein obviously cause some stress, because how you're going to respond, how the vaccine is going to work, things like that. The Brazilian and the South African strain also came independently from UK strain. And the concern is by changing multiple area of nucleotide, these viruses can escape your immune system and escape the effectivity of the vaccines and might be even more easily spreading. Those are the concern for those 3 mutations that we are seeing.
So, Dr. Sharaf, so people are asking, should we be worried that maybe the vaccine that we have right now will not be effective against the new strains? So, some of the evidence that came back actually last week from the 2 new vaccines that were reported, the Novavax and Johnson & Johnson, that were tried actually on patients who have the new strains in the UK and South Africa, which showed less that the vaccine is less effective with the new strains compared to the traditional or the old strain. We're going to call it the old strain. Should we be concerned about this?
Yeah, there is. That's true. I mean, the vaccines are less effective on the new strains, but still, it is effective. So with the UK strain, it's around more than 85-90%, which is actually a very good effectivity. With the South African strain, it's less effective, but it's very important to understand that it really prevents the severe disease, which is very, very important. So even if you get the, the data showed that 100% of the people who got the vaccines, they didn't go to the hospital and there was no deaths at all. So that's very, very important. It really diminished the severe symptoms, and that's very important to know. So still, the vaccines are working against the UK strain as well as the South African strain. To less extent with the South African, but as I said, it prevents the severe disease. So it is very important to get the vaccine, and also getting the vaccine will help to diminish the virus in the community, and that will help definitely diminish the strains or the replication of the virus and the strains production.
So that's a good point. I think, Dr. Tabriz, people ask how come that we're getting these strains. I think it's related to the fact that we have a virus that is replicating very quickly and it's spread in the community. And viruses, by nature, have mutations, and this mutation can lead to new strains, and that will change the behavior of the virus, so it can be spreading faster. So that's what we have seen in the UK and the Brazilian and the South African strain, that is spread faster than the old strain. One person can infect more people, and maybe the current measures of one mask and the social distancing of 6 feet is not enough to prevent the spreading of these new strains. And also there's some evidence that even the South African strain may be causing more severe disease. So changing the behavior of the virus is related to the fact that we have these new strains that are because of the replication of the virus. And the best way is to continue doing what we are doing and actually even have more strict measures. So what do you recommend to prevent the spreading of these new strains, or maybe the formation of other new strains that could be even more dangerous, that can cause more severe disease, more death, more hospitalization because of the change of the behavior of the virus?
Yeah, it's a very interesting point, as you mentioned, that as the virus interact with the humans, because the virus will not survive without having a host like human in this case. Survival strategy for the virus to change its structure so it can survive the immune system as well as the treatment. The interesting point here is, one of the hypotheses, one of the thought processes, the UK variant, the B117, actually started because of possibly what we have done to the virus. If I give you this story, what the thought process is, there was a patient who had weak immune system because of blood cancer, leukemia. And this patient was an exceptional patient. He had multiple admissions because of his weak immune system. He was not able to clear the virus. So every time he would get to the hospital, he would get the antiviral medication, remdesivir, as well as convalescent plasma. So what happened, in the same person, they found multiple different kind of mutation and different kind of viruses. Eventually, that one of the thought processes, because of the pressure from the treatment and plasma, this virus mutated in a way so it can survive. So the reason I'm saying that, we have to continue to treat who are sick already in the hospital. However, similar to when we give antibiotic for any bacterial infection, the bacteria become resistant. Similarly, we are seeing the same phenomena. Because we are treating with plasma, antiviral, and things like that, the virus is going to continue to try to mutate and change and survive. So that's one thing. So what is important here, as you mentioned, important here is we get over this pandemic as soon as possible. Otherwise, we're going to see all this different kind of strain, different kind of mutation, and we're going to have to just always catch up. The game will be, we are always going to be behind. So what are the things need to be done? Number one, we need to continue to prevent any exposure, means we do our social distancing, we use mask, whatever recommendation come from CDC.
Now, would you recommend to use 2 masks instead of 1, like Dr. Fauci has been saying? Maybe 2 masks would be better to prevent the spreading of these new strains that are more transmittable than the old strain?
So this is an evolving kind of idea. I don't know if they will come up with a conclusive recommendation, use 2 masks, but that's something being studied and looking at. You know, when we use mask in the hospital, we have a surgical mask that has 2 layers inside in anyway, right? You have the filtration. The problem is the seal. That's where the 2 masks might have some benefit. When you have 2 masks, you have better seal of the nose and the mouth. But the filtration itself, even if you use 1 surgical mask, is good enough. I think down the line we'll see more data, but consistency is more important. If you are using consistently, even with 1 good, WHO has some recommendation, what kind of homemade mask even you can do. Those are supposed to be actually 2 layer in anyway. So I think we should follow what CDC says. What I was saying that, this is very important that we continue to do those mass distance, avoid gathering until we have natural and herd immunity by vaccine. And number 2 is whatever vaccine is available, as soon as we have that opportunity to get the vaccine in that age group or whatever criteria we meet, everybody should be jumping to get it done. Otherwise, we're going to have, all this different kind of variant and mutation. So we need to get it over so we don't have any host for the virus. So I know the vaccine sometimes cause some question and concern for many people, including healthcare, personnel. So that should not be the case because science, proved that in addition to the, prevention of exposure, we have to have this immunity by giving vaccine. So that's important.
So we'll switch gear a little bit here to the new vaccines that came out, the new good news actually in the last couple of weeks. One of them is about Johnson & Johnson vaccine, which we were waiting for. And the advantage of this vaccine, that's only 1 shot. You don't have to keep the vaccine in very low temperature. The effectivity and the safety came out last week, and they were not as impressive as the Pfizer and the Moderna, but they were very good, more than 80%. And then we have about also the Novavax vaccine, also which also has good effectivity and of course very good safety profile. And then we have the Russian vaccine. We have the publication of their data, which actually were very impressive, surprisingly, 91% effective. And then we have the Chinese vaccine. So we have now a basket of vaccines. So Dr. Sharaf, what do you want to tell people about these new vaccines? Should we be happy that we have now a variety of vaccines with different effects? All of them actually showed that they're effective and safe. None of the people who went through the phase 3, 75,000 people, died because of the vaccine. So they're very safe. They prevent the disease in general. They prevent severe illness. So even people who got infected with the vaccine don't get hospitalized, have less likely to have severe disease, and there is no death. So this is very impressive. And also there is some data that showed actually it slowed down the transmission of the disease. So what should we be happy?
Yeah. Actually, we should be happy to have the vaccines, and this is a blessing. But we have to get it in the arms of the people, and this is the most important thing. So we have to actually, educate the people and tell them about the results and the science and what the research and the studies are showing. And it is a blessing actually to have a vaccine available for you. So all the vaccines, some people, they are afraid from getting the new technique, for example, the messenger RNA technique. So you can get the other one. You can get the other ones, which is available as well. And it's already, old technique. It's already have been used for a very long time. So it is a blessing to have different vaccines with different platforms, different techniques. So you have to get the vaccine, and everyone should actually think about it and should get the vaccines as is when it's available for you. So and when you meet the criteria for the vaccination. So if we don't reach the percentage, the magic percentage, which is the 70%, almost 70% of the population, we have to reach that percentage so we can have the herd immunity, what we call the herd immunity in the community, to prevent the spread. So it is very important to everyone to get the vaccine. That's my message to everyone. Just go ask your doctor, ask the hospital you go to, ask the health system you go to. Try to send them an email if you really meet the criteria now, so they can give it to you.
So, Dr. Tabriz, the question I get from my patients, and I had a patient in my clinic yesterday, this skepticism about the vaccine. And one of the most common question is, how come that we got this vaccine produced in very short period of time? This is fishy. Usually the vaccine takes 5 to 7 to 10 years to develop. Some viruses we have no vaccine in spite of the all effort, like HIV has been there for more than 30 years. It killed 32 million people. So how come that we got this vaccine quickly? Is this a reason for concern?
Yeah, that's a question among many healthcare personnel, even not only just general population and the patient. We have to understand what are the platform, what are the method that we are using to develop all this vaccine that's available. It's not completely new. The technology is not new. It's just being developed in a very rapid time frame because of the world is going through a pandemic. There are multiple points I would like to highlight here. Number one, if we talk about the mRNA vaccine, the technology, being developed since early 90s, 92, the mRNA was being looked at for cancer treatment, vaccine, and things like that. It was about 10 years or 12 years that they were able to figure it out how to deliver that mRNA into the human body. That's where you already have everything developed. All you needed to do is find out what the genetic code, and you use the perfection that have been achieved in the last 20-30 years and just introduce it and get to the human body. The mRNA has been used for cancer treatment and things like that in clinical trial. So number one, so it was not a completely new technology in terms of the mRNA. Number two, if you talk about the Johnson & Johnson adenovirus vaccine, this technology is also not completely new. This adenovirus has been developed by Johnson & Johnson over many, many years. They have developed to get it the Ebola vaccine, which has been already approved. So that's not completely new. If you talk about the other platform, the platform has been known to us for many years. All we needed to do is just concerted effort, money, will, and second point is when you do a vaccine trial, one of the important things, you have to have enough participant. You have to have enough patient to do the trial, right? Here we are in pandemic, so you have hundreds of thousands of people who are already at risk or getting infected. So, recruiting patient is a huge deal, when you develop a vaccine. So here, because of the pandemic, you have that. Number three is, the vaccines, before even they were showing success in the clinical trial, because of urgency, money has been put in there already, whether it works or not, the company will not lose the money. That was an incentive. So the manufacturing part was already being developed as we are going through the clinical trial. So if you combine those factors, none of this vaccine actually has escaped safety concerns or efficacy concerns. Everything has been met that need to be met in different trials to come to this point. So that's my message is for the healthcare personnel and non-healthcare personnel, general population, you don't have to worry about the safety or efficacy because everything is in place. We just put a lot of effort by government and non-government private sectors to come within a year, we have the vaccine.
So that's excellent. That brings to attention some of these, again, conspiracy theories that are floating. So there was this report about a few patients in Norway who died after they got the vaccine. And of course, the easy explanation that these people who died because they had either car accident or because they had myocardial infarction or a stroke, most of them are very elderly and they are prone to death like anyone else. So when you hear this report, which is inflated by the media and social media, people will link the vaccine to death. What would you like to say about these, kind of conspiracy theories that the vaccine can lead actually to death, like what happened in Norway, or in one patient in the UK who also was an elderly who died because of natural causes, but he got she got the vaccine a few days before?
Yeah, that's also a very good question. I would say that, we are vaccinating or target to vaccine for millions and billions of people, right? And there is always different kind of disease in the human population that happens no matter what, whether you give vaccine. If you drink water and you go outside and you get a heart attack when you're shoveling snow, you don't say, because I drank the water, that's why I died when I was shoveling the snow. So similarly, if you had underlying conditions, you have other comorbidity, terminal illness, we want to vaccinate them. And you get the vaccine for whatever reason, after a few days, you have heart attack or cancer, whatever you're going through, you died. Saying that, okay, a patient get vaccine after 4 days, they died. In Norway, most of these patients, 23 or 29, I believe, they are more than 80 years old. They are already kind of very immunocompromised, so on. So they have looked at that, and none of them actually could be attributed to the vaccine. I would give my personal, experience. As you know, I'm an infectious disease physician at Christ. I see a huge volume of patients there. In last week, I have seen two patients I was consulted. One of them actually came to the hospital because of all what we call sepsis, like, infection, some sort of infection. And happened to be this patient received a vaccine just 5 days before he came to the hospital. And he has all this abnormality, low blood count, low platelet, fevers and things like that. And my evaluation is this is because of something else causing the infection, not the vaccine. However, the perception in his family and his, people who knows him is thinking what? Because he got a vaccine 5 days ago, that's why he's in the hospital, that's why he's sick. That's what's happened in the media. When you hear, 50 patients were vaccinated and 3 of them in the hospital, but these 3 probably would be in the hospital whether they get a vaccine or not. As of now, the safety data is pretty good for all these vaccines. 0 death, 0 severe side effect. All the side effect that we are seeing, all this vaccine is expected, like any other vaccine, or maybe a little bit more than some other vaccine because of this is a new technology. But these are mild fevers, pain, body ache, things like that. So I would not, go panic and say people are having neurologic problem or death or things like that. That's not scientifically sound at this point.
Did you get the vaccine, Dr. Breeze?
Yes, I actually did on the first day that was available to me at Christ. Christ started the same day I got my first dose, and then after 3 weeks I might get my second dose Pfizer vaccine. And not only that, my nephew, who is a medical student, my daughter, who is a pharmacy student, they also get the vaccine.
How about you, Dr.? Did you get the vaccine?
Yeah, I got actually the vaccine also in the when it was available to me. I got it in late December. Then I got the second dose in early January. So I'm almost a month after, like 1 month from the second dose, actually. And I'm still alive.
I got the vaccine also when it was first available to me, even though that I got infected in April myself. So this is a very common question that comes to us, that if I got infected, should I get the vaccine? And the short answer is yes. The recommendation is to get the vaccine because immunity from the vaccine is stronger and longer than the natural immunity from the infection. I had one question actually by a person who said that his relative got the first shot of the vaccine and then she got infected a few days after. And of course, I mean, the explanation that she did not have enough immunity yet from the vaccine because it takes several weeks to get the immunity from the vaccine. So she got infected a few days after the vaccine, and that happened to many individuals or several individuals. But then his question was, should she get the second shot of the vaccine? And if that's the case, when? She recovered from the infection. So
the current recommendation is if you have first dose, for example, in your question, and then you develop the infection, you still should continue and schedule your second dose. The duration or time period should be if the person is recovered and they are not symptomatic and they are not considered infectious, means they complete their isolation time, they should still be able to go ahead and get the second dose of vaccines. Whether it's going to be 4 weeks or 6 weeks from the time that they have the infection, it depends on the symptom, depends on the isolation time period. So there is no contraindication. It's not going to do any harm. That's what the message is, and that's why we don't have to even check our antibody whether we are infected before or not. You just go ahead and schedule your vaccination.
Yeah, I mean, also a recent interesting study from the UK about AstraZeneca vaccine, that actually if you space out the second shot longer, that means you give the second shot 3 months after the first shot, the immunity and the effectivity of the vaccine is even higher. So maybe in the future, you don't have to get the second shot 3 or 4 weeks after the first shot. Maybe we can wait longer. Is that what we can conclude from that particular study?
So I would not extrapolate that from AstraZeneca study to mRNA study. There is a couple of things in AstraZeneca study. If you look at the details of this study, the AstraZeneca study was, initially started early on in April or so, early on in the pandemic. So they actually included patient, and then subsequently they saw that they have used 2 different doses. Okay, one of them were lower dose in the first, vaccine shot, and then second dose was full dose. When they found that because of some methodology in manufacturing in how many viral particles are in the vaccine, when they were evaluating that and trying to figure it out how to correct that, many of the vaccine participants did not get the vaccine, for example, 8 weeks or 12 weeks, right? So that was not by design, but by fact that was happening. And then when they did the analysis, they figured it out. The vaccine efficacy stayed more than 80%, even if you get the second shot after 12 weeks. That's where the basis of making that recommendation. You could still get after 6 weeks, some countries doing 6 weeks, 8 weeks, or 12 weeks, because the trial itself has some data, what happened in 8 weeks, what happened in 12 weeks, which we did not have for mRNA vaccine. Our mRNA vaccine was very well designed, well controlled, previous selection and everything. So the idea is shorter is not recommended for mRNA vaccine especially, means you should not get it earlier than 3 weeks, earlier than 4 weeks in Moderna case. However, it can be delayed because your body already making some memory cell is primed. And then that prime is basically the basis for second dose to boost. So that's why a little bit delay is fine, but earlier is not fine. So yes, in the future, we'll have more data. What happened in 6 weeks? What happened in 8 weeks? And then some modification might be, possible. And that's why we need to get more people vaccinated, even first shot. And they're considering, even up to 6 weeks might be okay.
Dr. we have 1 minute only, and we had this question about monoclonal antibodies and the role of that in the treatment of COVID patients. So what do you have to say about that? Of course, we will talk about treatment later on in future episodes, but what can you respond to that question?
Yeah, monoclonal antibodies actually are designed to give it to the mild and moderate symptoms. So patients with mild to moderate symptoms. So it's very important to give it early in the course of the disease. People they don't know about that, so sometimes they delay going to the ER, for example. If you test positive and you have some mild to moderate symptoms, then going to the ER is a good thing to get the monoclonal antibodies infused, because monoclonal antibodies, it is IV infusion, and it has to be done in the ER and to go through monitoring at least for 1 hour after that. It prevents hospitalizations and serious illness.
So patients who should be tested positive for COVID have mild to moderate symptoms, they should not be hospitalized. So patients in the hospital are excluded. Patients should not have pneumonia. That means they should not be requiring oxygen. And they should also have risk factors that will increase their risk for severe infection. That means patients who are obese, patients who have diabetes, patients who are immunocompromised, patients who have COPD or hypertension, in addition to being above age of 55. And these are the criteria for patients who require monoclonal antibodies. For patients who are young and healthy, even if they have, every one of them will qualify to monoclonal antibodies if they do not have the other risk factors that I have said. Well, thank you very much. This is very helpful, and hopefully we'll see you again next week. Any last minute of wisdom, Dr. Breeze and Dr. Sharaf?
Well, I think we covered pretty much on the vaccine, but the message, not the wisdom, but the message is, as all of us said, that we took our vaccine. We want to get out of this pandemic, go back to normal life, continue your prevention of exposure, and get the vaccine whenever you have the opportunity, no matter what vaccine is it. Is it Johnson & Johnson, Novavax, Pfizer, or Moderna? Any vaccine available, go ahead and get it.
Dr. Sharaf?
I say also the same thing, continue the mitigations and get the vaccines so we have the 70% of the population vaccinated. That's very important.
All right. Well, share this with your friends and network. We'll see you again next Saturday. Thank you. Have a nice weekend.
Thank you.
Thank you.